Welcome back. Today we are talking about a topic near and dear to my heart, acid reflux. It can also be known as GERD, whichever you call it. We have four key ingredients that are going to be helping to soothe out the mucosal layer of the GI tract. I have found this product to be extremely helpful in a multitude of patients that I see here in the pharmacy. I've been using the ingredients in this product now for over 20 years. My medical disclaimer, I will let you read that at your leisure. Again, always consult your physician before starting any type of nutritional supplement. So if you have questions, certainly give me a call at the pharmacy and we're more than happy to help. So DGL, I'll explain that in a minute, but that is deglycyrrhizinated licorice root. And there's really four essential clinical applications that we're going to talk about, but supporting GI health, promoting the healthy esophageal lining. When I had my endoscopy done, and those of the patients that have came into my pharmacy, and we've reviewed those results together, it's you look at what the gastroenterologist describes as a very irritated, red, and inflamed esophageal lining. There's a lot of different ways that can restore that function properly. We're going to talk about some of those natural products today. DGL Essential can also help maintain the healthy mucosal surface layer in the stomach. So those of you that are suffering with maybe some type of ulcer or something to that nature, or you're on chronic NSAIDs, we've talked about that in previous videos. This is something that you may want to consider, again, adding to your supplement regimen to help with your GI tract, right? And we know with a poor GI tract that we can have dysbiosis or bad bacteria in our GI tract, in our stomach, in our intestines, in our large intestine. And so DGL has been shown to help promote bacterial balance. So we'll get into that today as well. So let's look at these four nutritional supplements to help soothe the GI tract. And you can see a picture there of aloe vera. We're going to be talking about that in just a moment. So just a quick overview so we're all on the same page here of heartburn and acid reflux, and there's a lot of different terms out there. I mean, the heart obviously has nothing to do with it. So this condition, these symptoms are sometimes blown out to be they're scary, right? And it's like, oh my gosh, does this affect my heart? Well, no, it doesn't, but it's right over your chest. So just be aware of that as well. So there's really a misnomer there. It has nothing to do with our heart, our cardiovascular system. It's our esophagus and our GI tract, and it hurts like hell sometimes, right? So 25 million Americans suffer with GI mucosal complaints in their lifetime, me being one of those patients. This is something that's interesting here, that common bacteria from food is often the root cause of GI discomfort, not poor diet and stress. Of course, diet and stress certainly contribute to that, right? We all know this. But it could be something like H. pylori. We're going to talk about that in a minute. What is H. pylori? Why is that so important? And how do we get rid of that critter in our stomach and in our GI tract? So we'll look at one of the ingredients that's in this DGL Essential that could possibly be very beneficial to you. And we don't want to forget this. The GI tract is really one of our first lines of defense against unwanted organisms entering our body, right? We have this acidic barrier in our stomach to kill off a lot of parasites and viruses and so forth. Doesn't do a perfect job, of course, but it helps to reduce that viral load and that bacterial load. We don't eat sterile food. Again, this is we all know this, but sometimes we forget some of these sometimes common sense, the physiology of the way the body works, because then we're taking a medication that is disrupting our physiology, right? We're taking a proton pump inhibitor. Well, what does that really mean? We're blocking stomach acid production. And before I get too far in today's talk, I just want to really briefly mention here one of these books here that has changed my life, by Dr. Jonathan Wright, one of my mentors. I read this book back in 2005 when I was dealing with acid reflux issues, and I came across this book, and this flew right in the face of what I learned in pharmacy school for 4 years about pharmaceuticals and antacids and so forth, and you're like, whoa, stomach acid is good for you? Pump the brakes, hold on here, what is going on? So I would highly encourage you to take a look at this book. You can get it on Amazon or anywhere else books are sold, in most places, of course. So why stomach acid is good for you? Why are we blocking that in the first place? Of course, if we have a GI ulcer and a bleed, we want to neutralize the acidity in our stomach. But essentially beyond that, we should be looking at possibly other alternatives. So DGL, deglycyrrhizinated licorice root. Stay with me for a few more minutes here. I'll explain why licorice root has to be deglycyrrhized. But there's a clinical trial, double-blind, placebo control. So again, we're talking about evidence-based studies that are looking at these supplements. I'm not just making this up and saying, hey, look at this, I think this might work. Well, there's actually, again, the issue with, not to go too far on a tangent here, but some of these supplements get poo-pooed because there's not all these robust studies that we're looking for from like the pharmaceutical industry. Well, who's going to sponsor this? There's no patent. There's not a monetary incentive to do some of these larger studies that we might be looking for. So keep that in mind too. But anyways, 56 of subjects taking the treatment arm improved in symptoms of acid indigestion. Another study looked at 874, not a huge study, right? But 874 patients receiving DGL versus cimetidine, found that DGL was effective in relieving GI discomfort. So cimetidine, one of these H2RA blockers, histamine blockers for the stomach, again, very helpful. I'm not saying it's not, but if there's maybe a safer alternative that may not be so physically addicting, this might be a better choice. Again, talk to your provider about this. Here's some information here. Randomized double-blind placebo-controlled study evaluating the efficacy of DGL in H. pylori infections. Why is this study important? Well, H. pylori can basically exacerbate some of these ulcers in the stomach and can never get them to fully heal. So back in my day when I was doing traditional pharmacy, we had these, it's a PPI, an antibiotic, and it was there to help with eradicate H. pylori essentially. And there's actually 2 antibiotics in there. The point is this, though. Now you're taking 2 different antibiotics and a PPI, and yeah, you're killing off one bug, but big picture-wise, and I don't know if this has been studied, but maybe you're creating another dysbiosis further downstream that we might not be aware of, right? So we got to sometimes look at the bigger picture here of what's the long-term effects of this medication, right? We all know that these medications can be very powerful and have some very serious consequences if not taken appropriately or if we stay on them too long, right? So a statistical difference seen after 60 days versus placebo. DGL 56, there's that number again. Not sure why that same percentage came up in those 2 different studies, but here it is. Tested negative to H. pylori versus only 4% in the placebo group. So pretty impressive there. So, marshmallow root. Next ingredient here, a traditional soothing herb with a history of use for coating the gastric lining. I can't stress it enough, especially the LES, the lower esophageal sphincter. I'll put a link up to one of the other videos that I did. This was 11 years ago. I've been talking about acid reflux and some of the negative consequences that we can see with long-term uses of PPIs and general antacids. The problem here is, yes, they block the acid, but they really don't do a great job of healing that soft tissue. So that's something we should be looking more at, in my opinion. Contains mucilage polysaccharides, which absorbs liquids to provide a soothing property to mucous membranes. Wow, that sounds great just saying that. And then here's the German Commission E, which is very similar to like the FDA. So this is the Germany equivalents of the FDA, approved the use of marshmallow root for helping to establish a normal inflammatory process within the gastric mucosa. So think of it like a natural Pepto-Bismol, right? So marshmallow root, something else we may want to look at if we are suffering with acid reflux and indigestion. Aloe vera concentrate. I'm sure we all have heard of aloe vera for like you get a sunburn, right? Why is that so effective or can be effective? It's its soothing property. Aloe vera is a soothing herb. It's been used throughout history. It's actually mentioned in the Bible for its spiritual significance. Studies have shown benefit to the gastric mucosa, and I will list all of these references at the end of this talk. And an animal study showed aloe vera was helpful in proper gastric acid production and aiding in mucosal protection at low doses. So again, aloe vera, not only does it soothe, but it can help balance out if we're producing too much acid or not enough. Generally speaking, here's a key point to this talk, is that when your provider puts you on an antacid, I would encourage you to have them do a stomach acid test. Most often than not, it's not an issue of overproduction of stomach acid. It's usually that you're not producing enough. Let me say that one more time. When we are suffering with heartburn and again, GERD, acid reflux issues, What might be going on in most cases in the research that I've done is that it's not an overproduction of stomach acid. If anything, it's an underproduction. The LES, the lower esophageal sphincter, I'll try to get a picture here so you can see this on the video, but there is basically a door or a high pressure system, a sphincter, right, a muscle between the esophagus and stomach. And when there's enough acidity in the stomach, there's a negative feedback loop going from the brain back down to that sphincter that says, oh, there is a lot of acidity going on in the stomach. I need to clamp down on that door. So that is very important to understand, because when you're giving somebody a medication or over-the-counter medication, OTC item, you're reducing their acidity, right? You're making it more alkaline, and that is causing that LES to loosen up. So sometimes that's why apple cider vinegar can be so effective, because it actually is helping to clamp that door back down. So I digress there, but just know that aloe vera can be helpful in proper management of the pH balance in the stomach. Slippery elm. What do we know about slippery elm? Well, there wasn't a lot of great information out there on slippery elm, but it's a traditional soothing herb. It's been used for a very long time. It's, again, rich in this mucilage that helps maintain proper inflammation in the body. So again, not all inflammation is bad. We do need to have some level of inflammation, of course, to respond to different threats, essentially, in our physiology. But just know that slippery elm can be very effective, really in combination with a lot of these other agents. A study of slippery elm in combination with other herbs and nutrients helped to relieve GI symptoms in 60% of patients in both upper and lower GI symptoms. So it's a nice little add-on there, and that's why we put it in this DGL essential product that we now carry at the pharmacy. I'm going to pause right here for just a quick second. Think before you buy, though. You're going to watch this video. 90% of you aren't subscribed to our channel, so I encourage you to hit that subscribe button. It's important for us to, again, keep getting this information, the content out about, again, more natural ways to improve our physiology and the way that our GI tract is working. Not all DGL is created equal. DGL Essential, which is the product that we carry here, contains a patented form called GutGuard. GutGuard has been clinically studied. I've got a couple of those here. Again, I will put references to these studies on the last slide here, so you'll see that. You can get all that information. But efficacy and safety of GutGuard in managing gastroesophageal reflux-related symptoms, a phase 3 double-blind randomized placebo-controlled trial. And then this study here is talking about GutGuard in the management of H. pylori. And this was a randomized double-blind placebo-controlled study as well. So again, put those links. You'll see those study references at the end of this presentation. So be aware of that. So we create new standards for optimal supplementation protocols. We have quality ingredients. We have the right ingredient at the correct dose. So we have to get to that therapeutic level. That's really important in my opinion, and that of many others. If you're not taking the right amount, it's not going to work. So sometimes we dismiss natural supplements because we don't know what dose to take. We're taking too low of a dose, and we're not going to see that clinical benefit. So that's super important. So the right ingredient, a quality ingredient, the correct dose, and then taken at the right time. So when do we take these products? These things are soothing agents. I kind of mentioned about Pepto-Bismol earlier, and you want that soothing effect. Well, you want to take this after a meal. You don't want to eat or drink, generally speaking, after you've taken this, to kind of wash this down. And I will share with you one other product that is a powder formulation with similar ingredients compared to this DGL. It's very similar. There's a lot of synergy there, and that similarity, sorry. That other product is a powder that you mix, and you drink that after each meal and before you go to bed, and that too can be very soothing. And here is our Shopify account. Here is the product here on that website. It is mdcustomrx.shop. I encourage you to take a look at that if this is something that might interest you, or give our pharmacy a call, of course. We are located in Brookfield, Wisconsin, the middle of nowhere, Wisconsin. So come visit us. We are here. Or follow us on Facebook. Follow us on Instagram. Of course, if you're watching this on YouTube, you already know we have a YouTube channel. How do you get a hold of us? So we are here Monday through Friday, 9:30 till 6. There's our address there, our phone number, toll-free number, of course, and our website. So there is myself, there's Tucker, Dane, Emily, my wife Monica. We are all here to help you, trying to essentially lower that medication load. ideally, to live optimally, we can't be, in my opinion, hanging on to 5, 6, 7 different pharmaceuticals, managing all these side effects. Eventually, that's going to catch up to us, in my opinion. I've seen it over and over again. Here are all the references, so just be aware of that. Something that I forgot to mention, glycerized content is important to understand because licorice root extract containing the glycyrrhizin can potentially lead to what's called pseudo-aldosteronism, which can lead to side effects such as high blood pressure, headaches, fatigue, and heart issues. So you want to make sure that the licorice root is deglycerized, meaning it's not going to cause this aldosterone, pseudo-aldosterone issue in your system, in your body. So that's very important to understand. Thank you for watching today's content. If you found any value in learning about these supplements and how they can possibly help your GI tract and resolve some of those heartburn issues, please share this with a loved one. Again, I also encourage you to subscribe to our channel, hit that notification, of course. We are trying to get more information out on supplements that can help basically turn your health around, give you optimal function. So again, thank you. Have a great weekend, and we'll see you next time.